There we go. Sorry, guys. Technology. Do you guys see my screen? I can't find my presentation now. Mm. There we go.
Okay.
Are we all good? Fantastic.
Yep. Go ahead to the next screen, please. So my name is Dr. Ross Danielle Rostetter. I've been in the profession since I was 17 years old. I am now going to be 49, whether some shape or form, as a kennel kid to a student to working in laboratory animal medicine to becoming a veterinarian and own my own practice. I am deaf and I utilize 2 bilateral cochlear implants. To advance, please. So my whole goal today, right now, with this keynote is to approach this from 2 perspectives. Pretty much every veterinarian out there is going to, at least at some point, have a client who has some challenges when it comes to hearing. So I also want to educate you that how you could communicate, make sure that the patient's care is being met, and then we'll get into some specifics about the deaf and hard of hearing within veterinary medicine as a profession. So some compensation strategies that you may be aware of that those that are deaf and hard of hearing use are speech reading. And the problem with speech reading is many sounds or words can look the same, like olive and I love you. And as you can imagine, medical terminology, even when you're trying to talk about it on a layperson's term, can be even more challenging. So speech reading has limitations. There's also environmental control that you may see people that are deaf and hard of hearing use, such as how they position themselves next to you. They're good ear near you, maybe turning on a light, maybe just getting closer to you. They may even do environmental control by bringing in things to write on or ask you to give them handouts to read at home, because we have to focus so hard on hearing that sometimes the comprehension and understanding what you're trying to teach us as pet owners may need to be absorbed at a later time. They also may more heavily want to use email or texting, obviously, than the phone. Those that are deaf and hard of hearing often put a lot of weight into body language, your expressions on your face, how you look. You know, are you saying good news? Are you saying bad news? And a lot of us also are very proficient in filling in communication gaps. For example, before I had my implants, when I was considered profoundly deaf and I was told a sentence maybe of 7 or 10 words, I actually may have only clearly understood 2 or 3 of them. But by knowing what was going on around me, especially if I knew the speaker well and how they spoke, I could fill in the gaps and make some educated guesses as to what the person was saying. That's one technique. Go ahead, please. You may, deaf and hard of hearing, repeat back or rephrasing information. I absolutely love this. I teach my students and my staff that closed loop communication. Not only is it good medical practice and it's used extensively in human medicine, but it's a fantastic technique to make sure that communication has accurately occurred. The other thing you may see utilized to help compensate for hearing loss is assistive devices, obviously hearing aids, cochlear implants, but you may also see things called FM systems where the speaker wears a microphone and it basically makes it sound like the speaker is talking directly into the person's ear. It gets rid of the sound degradation that will occur over space. You may also see people using interpreters. There's different types of interpreters. There's your traditional sign language, which you're seeing here. There's also cued speech. There's even oral interpreters. People, as I mentioned, those we talk to a lot. We learn how their lips move. So some people that rely heavily on speech reading don't know sign language, will actually employ an oral interpreter who basically just mouths what the person around them is saying, but they're so familiar with that person, they can read their lips easily. Be careful about letting a friend or a family member interpret for you in the veterinary setting. It may not be a huge deal when you're dealing with something simple, but if you are dealing with a serious situation with a pet or a client communication, a disgruntled client, something like that, these people are not licensed, they are not legally bound. Especially children are often used for deaf and hard of hearing parents as interpreters. This is kind of across the board for language interpreting, from foreign languages to hard of hearing for sign language. So just be aware of that. And as we've had, for those, some of us today, we have live captioning, or there are even apps on the phone that you can download that will take in the sound and transfer it to text. It's not perfect, can help. Go ahead. The biggest thing I want to convey is when you have a client or a colleague or a student or a professor or an employer or an employee who has a hearing loss, ask them what they need. Do not assume. And unfortunately, that's where a lot of frustration will come about, even some legal lawsuits, because people will assume that they know what this person needs. But everyone is different in their hearing loss, because hearing loss is different. How we've been raised to communicate is different. Even just our own personal preferences. For myself, I have used so many different strategies throughout my education and my career, and it's changed based on different things, based on the environmental challenges and also my hearing loss. Please keep in mind, I mentioned earlier that we have to focus so much attention on listening sometimes that the comprehension may have to come at a later time. Hearing loss is fatiguing. We have to work harder to hear, and so we have less chance to process. So just because you communicated to somebody, especially if it's an emotional situation, let that pause stay. When you're done talking, you don't need to fill it. Let people think about it, process it, and then respond. Don't be afraid about that pause. Go ahead. But having said that, you need to ask them what they need. As a general rule, there are some things you can pretty much assume that you doing will help with anybody you're interacting with. Get their attention before you talk to them and stay in one spot. Be aware if there's light behind you that would shadow your face in case they're a speech reader. Even if they're not a speech reader, as I mentioned, the facial expressions, the emotions, those are important. Those are communication. Don't place anything in or in front of your mouth. It is a challenge for those of us that have to try to interact with people with beards that come down over their lips. I do remember one of my professors, when I came into his class, he trimmed his beard up higher, his mustache up higher, so I could read his lips easier. And then don't be afraid to pause a moment. If you're talking and you just want to say, hey, are you understanding me? Do I need to do anything to help you? Speak slowly and clearly. Do not yell, exaggerate, or overpronounce. Go ahead. So you may have run into seeing things where somebody doesn't hear something, so they say, what, or will you please repeat that? You can try repeating what you said once, but if they still don't get it, repeating the same thing is not going to likely to be successful. You're running into situations likely where they just can't put some words or phrases or phonetics together right, or they can't speech read a certain word. So try to find a different way to say what you're trying to communicate. Use your gestures, use your body language, use your facial expressions. If you have visual aids, use them. Be aware though, if you're holding that knee sample and trying to explain an ACL tear, you can't look at the sample and keep talking. You need to make sure that you're still facing them. Some veterinary clinics will have videos playing for clients while they're waiting in the waiting rooms, or at least before COVID started, and hopefully soon again. Caption them. If you have staff that have challenges with hearing, caption those too, because I know I use training videos for my staff. And the biggie one, this is a very inclusive thing, is caption your social media videos. That really will reach a lot of people, and you'd be surprised how many hearing people appreciate it too. Go ahead. So you've got a really sick pet and you are trying to communicate with a colleague or a client, and they may not be up to date on what you need to communicate. So if you have a big word like cranial cruciate ligament tear, you might want to write it out even, just to make sure you highlight key words that you're going to be using a lot. Just like we have been taught when we're dealing with our clients hearing or otherwise, avoid those yes or no questions. People want to make you happy, so they're going to say whichever yes or no they think you want to hear. Ask your open-ended questions. Be aware if you're building or you are just trying again to manage the environment, going to a good place to talk to somebody, improve the room acoustics. Don't go out in somewhere kind of off the side of the lobby where it might be loud, and try to talk to somebody who may have challenges understanding you. Pull them into a quieter room. And I mentioned this already, the emotions and the body language are really important. Show those, get into it. Go ahead. So what can you do to try to make sure, if you're trying to communicate with someone who has some hearing challenges, that you might be suspicious that they are not following what you're saying? Quick yes and no's. You will recognize it if you see it, that there may be more of a genuine, unique expression on their face rather than how is other people around me reacting, and how should I maybe react to model my body language about them. Glazed eyes, blank stares, the long pause as they're formulating a response. I did mention honor the pause and let them think about what they need to think. But I think if you're decent enough in your body language communication, you can tell the difference between somebody who's unsure what's going on and somebody who's just thinking. And then if they turn away and walk away from you when you're talking, maybe you didn't get their attention, that you needed to tell them something. Don't take that as being rude. A lot of times, maybe we just didn't know that you needed to say something, or we thought you were done talking and we turned away, and maybe you weren't. Go ahead. So I want to put a disclaimer on this. There are many, many people that take great pride in deaf culture, deaf communications, and in their deafness. There is a lot of benefit to it, but there are also people that they don't want to be an inconvenience. They are embarrassed about their hearing loss. So just be sensitive, be patient. Let them feel like they can ask you questions at your door, or you are willing to make the extra effort to communicate. Go ahead. So I want to talk about deaf and hard of hearing within veterinary medicine now. As we'll be going into the panel, there's a lot of that coming on. I'm excited to meet some of these people. There, as you can read this on your own, but diversity many times historically has focused on certain things and not disability or different abilities. And we need to change that. Go ahead. A quick background that might give you some ideas about my story. As I mentioned, I changed what I was using as I grew. I used hearing aids, FM systems, which is where the speaker wears a microphone, environmental management, speech reading. High school came along and I started saying, can I be a veterinarian? I obviously was concerned about things like communicating with a surgical mask on, with how do I use a stethoscope? I had a mild to moderate hearing loss, and my father found me 3 veterinarians that were deaf or hard of hearing, and they became my mentors, and they're the reason I moved forward. ahead. So like a lot of students that are in college, I've focused on strengthening my vet school application. But in addition to managing being a student and getting all that experience, volunteering, working that we all do, that as we become veterinary students, I also had to start figuring out how was I going to overcome some communication challenges. Also during that time, my hearing loss progressed to profound. That's like just about a step away from death. And I was trying to figure out, how am I going to handle it? Classrooms, large classrooms, surgery. How am I going to use a stethoscope? Starting to contact the disability offices at the colleges I was considering to talk to them. Go ahead. But I got into vet school. First try too. I was very proud of that. And vet school was an experience. I had to continue to use my hearing aids, my FM system, speech reading. I found an amplified stethoscope. I spent a lot of extra time reading ahead. So that way, again, I was familiar with that terminology that I had never heard of before. So when I saw it on a speaker's mouth for the first time, I might have a leg up as to what they were saying. Also reading ahead with surgeries. So again, I would have a sense for what was the next step, because I wasn't going to be hearing the professor tell me what the next step was. I also really expanded my self-advocacy, meeting with professors prior to starting courses to talk about my needs, to talk about what I needed from them. I can do a lot, but my educators needed to do some things too. And that's part of making an education inclusive. I also, for the first time, got into computer-aided real-time captioning in situations where I really could not speech read. Surgery, a class that had a lot of group discussion, so I couldn't follow that. Go ahead. But for me, and my experience is not everyone, veterinary school also led to a very major depressive episode. I was raised hearing. I spoke orally. I never learned sign language as a language for true communication with others. So there's a sign that the deaf has, which is you think you're hearing, H for hearing. And that's what I was. But I really, really hit me hard during vet school, how much my hearing loss impacted my ability to do things. It's tiring advocating for yourself. I was again embarrassed when I had to raise my hand one more time, or could you please repeat that, or ask somebody to stand in another location. And then, just starting to feel like maybe I'm not good enough to be a veterinarian. Maybe I can't do that. And there were some professors that were challenging. One I had to go talk to the dean of students with, and they had to follow up with him because he wasn't doing the accommodations I needed to be successful in his class. Go ahead. So I graduated, and it can be challenging for those with hearing losses in the medical field to find employment. I did find employment, though they were with a rather unique population of people that were open-minded, that or knew me before or knew others with a hearing loss. So their minds were already open. At that time, if you remember, I still had a profound hearing loss. So as soon as I introduced myself to a client, I would say, I'm Dr. Rostetter, I'm hard of hearing. You need to look at me when you talk. And I had no problem with telling people, I need you to look at me, again, as a reminder. My hearing progressed finally to death. Pretty much nothing came through my hearing aid. I had to start using voice carrier on the phone. I could not use my stethoscope anymore. I had to use palpation to assess heart function. Sometimes I would take an X-ray earlier than somebody else would. So I decided to get a cochlear implant eventually in both ears. And again, because of that step in my hearing loss, I went through another depressive episode and wondering again, can I do this? Can I be a good veterinarian? So throughout all this, people started contacting me through various methods. Either they heard about me through the professors, through the audiologist, through whatever method. Back then, we didn't have Facebook groups. We just had listservs. So I started getting tired of answering the same question over and over again. How do you use the stethoscope? How do you hear the paging system, the alarms going off? So I created a listserv, and that was Noise, where people could communicate and ask each other questions and find support. Go ahead. Eventually, it led to the establishment of a nonprofit. I worked with 5 other people to establish the Association of Medical Professionals with Hearing Losses in 2000. And go ahead, please. These are their main tenets that they focus on. They're trying to make healthcare as a field accessible through coming up with solutions and techniques, through technology development. They played a big role in specialized medical interpreter training, and of course, networking. Those times when I was struggling, it was other people that lifted me up and helped keep me moving forward. And now mentoring the new generations that are coming in. Go ahead. AMPL has also been involved in legal cases that have set precedents and opened doors. They have become a pool of expert witnesses, many examples of successful deaf and hard of hearing medical professionals of many different fields, also writing legal briefs that have been used in other court cases of people that are trying to obtain an education or employment in a medical field, and they also have a hearing loss. Has also become a big resource for others that are trying to be proactive, whether they have an employee or they're looking at bringing a student into the program, and they're trying to support those individuals. Go ahead. We also now do a lot of advocacy, so emails and blogs to people, and then just again trying to open the doors for people. Last thing I want to talk on is technical standards. I don't know how many of you are aware what these are, so I'm going to kind of quickly explain these. Technical standards are written by many medical educational institutions. And they are basically a student that comes in has to meet these standards. And currently, many of them are written in such a way that precludes individuals with disabilities from being accepted into the program. We're going to go over organic versus functional. Go ahead, please. An organic standard. Now, this is my alma mater for vet school. They say the student must be able to communicate efficiently and effectively in both oral and written forms using English. Somebody who communicates through American Sign Language, they may choose not to speak for whatever reason they have. They may be able to write okay. It can be sometimes a challenge. Sometimes English is second language for some ASL speakers. Purdue has one that they must be able to perceive natural or amplified human voice without lip reading. They're talking about surgery again when they're wearing surgical masks, but they're focusing on the person being able to have something in them. They're not focusing on the task. Now, Michigan State gives a little bit of an out. You can see in red, I'll let you read it on your own, but basically they're saying that if you demonstrate an ability to do what they're trying to get, then you can be accepted. Let's make it easier. Go ahead, please. Why don't we write functional examples, which is you're focusing on the task that the student or the employee is trying to accomplish, not how they do it. Here it is an example from medical school. The student must be able to communicate effectively with patients and family, physicians, and other members of the healthcare team. The communication skills require the ability to assess all the information, including the recognition of the significance of nonverbal responses and immediate assessment of information provided to allow for an appropriate, well-focused follow-up inquiry. The student must be capable of responsive, empathetic listening to establish rapport in a way that promotes openness on issues of concern and sensitivity to potential cultural differences. That leaves a lot of opening on how you're going to do it. ASL communication is effective. They can use that. They can use cued speech. They can use a voice interpreter. As long as you communicate effectively and you're getting the goal done, what does it matter how you do it? I want to give an example on the next slide. These are actually some job requirements for my practice. So I want my employees to be able to communicate. So I just say they need to be able to understand and follow directions and communicate with others. Again, how they do it is open. They need to be able to work with small or delicate items. How they do it is open. They need to be able to basically read animal body language. So I've never seen an alternative for that kind of visual thing, but at least it leaves it open. You have to be able to have enough mental control over yourself, whether that means that you have to take anti-anxiety medications on a daily basis, or you go to counseling, or you may have to step aside for a moment. There's still ability to be flexible. And then again, I need them to be able to transport 40 pounds frequently throughout the day. How they do it, again, is open. And they need to be able to work from ground level to up to 8 feet. So I'm focusing on the thing I need them to do. But having a deaf and hard of hearing person can be very beneficial to educational institutions and clinical practices. We are usually very good at nonverbal communication, picking up on the hints that something's not being understood, maybe being able to follow up and ask questions. We're highly aware of the environment and the situation. Even people that really don't identify as hearing loss, it makes it easier on them if we have a quieter environment, especially when we're trying to talk about something very serious. So we tend to pay attention to those things. Go ahead. So actually what's interesting is I have found that with the stethoscope that I use now, I can actually pick up heart murmurs that many of my hearing peers can't. And this has been verified by the cardiologist, and I'm pretty proud of that. But we'll have the cardiologist say, wow, I can't believe that you heard that. So sometimes the accommodations, the technology that we use can actually be pretty fantastic. We tend to be aware, because we are a minority and many of us have experienced discrimination, we tend to recognize it when it's going on around us. And because of all that we've had to do to get where we are, whether as veterinary students or practitioners, we've had to have a lot of resilience and confidence and asking for what we need. So these are really great traits to have in the workplace. Go ahead. And that is the end of my presentation. If you will go to the next slide, there is, if somebody wants to take a snapshot of that real fast, these are some of the resources, and you can feel free to email me. Thank you.
I was muted. Thank you so much, Dr. Rossiter, for setting us off for that and sharing your experiences and sharing your tips and tricks as well. I think now we will move on to the panel. I will ask, if you are not a panelist and you have your video on, if you can turn it off, because then that way Zoom will compact all the panelists to the top of the screen. So if you guys don't mind doing that real quick. And while you guys are doing that, I'm going to copy and paste the resources that Dr. Rossiter just talked about onto our chat as well. Alrighty. So I think a great way to start would to just be to run through introductions as well. We have 5 panelists here today. I don't know, Dr. Rossiter, if you wanted to we need to introduce you again. I mean, you guys know Dr. Rossiter. You guys, did you want to say something really quick for the panel?
No, I'm just happy to answer any questions, whether I'm on the panel or if somebody wants to message me privately afterwards, I'm open to that.
That's sweet. And then we'll just run down the line. Dr. Miller, if you don't mind introducing yourself.
Oh, my name is Jennifer Miller. I live in New York, and I went to undergrad at NTID, RIT, which is a deaf school. Growing up, I lived in a farm rural area, and I was the only deaf hard hearing kid in class. My hearing loss is from my genetics. My father's deaf, my mom's an interpreter. And it was progressive, which means I started out close to hearing, and then every year I would lose a little bit more and more and more. By the time I reached undergrad, I was functionally deaf, profoundly deaf. I used hearing aids I broke FM systems if they tried to attach them to me in school when I was young. And in undergrad, I used interpreters. And NTID was a very progressive, supportive place for a deaf individual, whether they're oral or using sign language. Gallaudet is another deaf school for college, undergrad in Washington, D.C. that's also strongly supportive of, teaching us how to deal with the rest of the world. So I applied to vet school and got in on the first try again. The only reason is because I already knew a deaf vet. She had already been to that school and she was brilliant. So that school thought all deaf people were just brilliant. And she already had interpreters there that interpreted for her. So when I arrived, I just had to control my own lesser ability compared to Kim Dodge. And it was a lot of fun and I really enjoyed it. I had a very good experience with vet school. There were some challenges, but I'm very stubborn and direct and controlling, and I'm an older sister, so it's easy for me to say what I need when I need it. And I went to work, I got married, I had kids, I bought a clinic. We're surviving the pandemic. I use sign with my staff a little bit. I use my voice a lot. Clients, most of them know I'm deaf because if I turn away, I don't understand anything and they know it. So they tend to be sensitive to that. I have a few deaf clients, but the majority of my clients in this farm area are hearing. So they get used to me and my phone caption and my emails and my ability to always be looking at them. They like that. But yes, I love what I do, and deafness is a very small part of it.
Awesome. Tyler, do you want to go next?
Hi, hello. My name is Tyler. I'm a first-year student here at the University of Florida Vet Med. I'm from Western Arizona. I moved here last year. It's a completely different world here. I was born from deaf parents, and I've got a wonderfully deaf parents. I used ASL. It's my first language. English is my second. I grew up kind of vacillating between both of those languages. In undergrad, I went to Arizona State University. I graduated there with my BS degree in biological sciences. I went to ANU Western University and got a degree there in biotech science as well. And so now I'm here, thrilled to be starting my vet career at the University of Florida.
Yay. We'll go with the other first-year vet student, Madison.
Hi, I'm Madison. I am from Miami, Florida, so I'm used to this weather. Don't much enjoy it, so hopefully I'll go up to the cold soon, which is weird for most people, but I hate the heat. I was born hearing. I wasn't diagnosed with my hearing disability until I was about 19 years old, so I was kind of side passed all throughout my younger ages and just called kind of slow and just didn't really get a pure diagnosis because my hearing tests do pass off as normal. I do have what's called a central auditory processing disorder. So it's a type of hearing disability where my hearing is normal, but my understanding of speech is severe. So while I have a neurological disorder, which affects the auditory nerve that helps the signals comprehend and interpret sound and words. So I may be able to hear you, I don't know what you're saying. So it's not a very well-known disability, which is something that I'm still struggling with today, as a lot of people pass me off as hearing, and I'm still trying to find my place and how to handle that. I got into vet school and I used bilateral hearing aids. I used assistive technology devices. I used FM systems in undergrad and closed live captioning, but it's still a learning curve. So something I'm still working on to this day, but I highly use lip reading as well. So just a all comprehensive thing together, but it's just something that, like, you don't know, you're in the hearing disability world, the hard of hearing world, you're not in the deaf world. It's just kind of something that is confusing for a lot of people, but I'm trying to help make it well more known. So happy to be here, happy to be a proud person that has a hearing disability and owns it.
Yes, for sure. And we loved having you at UF. And last but not least, Miss Stacy Short.
I'm sorry, this is the interpreter. We are unable to see her hands at all. Hold on. So if she's speaking,
Here we go.
perfect. Thank you. Thank you. Perfect. That's great. It's nice to meet you. I understand most of you might have had a hard time, and it really is just, it's hard to focus, but I understand lip reading is difficult at best, and the words that you have to go through just to understand that. So I'm understand, and I'm glad to be here. So, but anyway, whatever you are trying to accomplish, you can do it. I know you can. Thanks for having me.
Thank you for being here, Miss Stacy. Um, for those of for those who don't know, Stacy is actually the mother of one of my classmates. So she is here today to help us provide the hey Addison, to help us provide the client perspective as well. So you really wanted to cover all aspects of veterinary medicine today. So without further ado, we can hop on to the first question on our list of questions. With thank you to everyone who submitted questions. And the first one is, what benefits do you think coming to VetMed as a deaf person or with a hearing impairment provides? The focus can be around accommodation to a hearing world, but what do you think hearing colleagues could learn from your insights? I don't know who wants to take this one. I'm going to start
Who
picking
wants
on.
to answer this one?
I'm going to pick on Dr. Miller.
I mean, I kind of touched on this already, so I was hoping Dr. Miller might want to do that.
Do you want me to answer this?
Yes.
Okay.
For me, the biggest benefit of not being able to hear in my environment is that I don't make assumptions. I have to be looking at the whole picture. I have to be making eye contact, and I have to be watching that animal and the people around it at all times. I'm a farm girl. If you don't do that near cows and horses, you get hurt. If you don't do the right thing with very strict people, you don't get asked back. So you must always be, paying attention to your surroundings. So that's my chief benefit for me growing up, was that I had to always pay attention. I had to always understand where I was in my environment. So when I got to vet school, the hearing students had to learn how to do that. They had to learn body language and where to stand in a room and how to seem like they knew what they were talking about. I've been doing that for 22 years, seeming like I knew what I was talking about. So that's a big benefit for me.
That's awesome. Maybe
One
Tyler?
thing, this is Tyler. One thing I'd like to add. I know for myself, going to graduate school, and now that I'm here, I have a lot of classes with people that I have had, and I've noticed that as I meet people for the first time, they are a little awkward with how to deal with me. It might have been the first time that they have met a deaf person in this profession, but it takes a little bit of time. And after that, they learn, how to really handle things with me, have that eye contact, that I am going to have an interpreter, and that I'm all inclusive. I want to be involved. And I've learned a lot, and I know they have learned a lot working with me.
Awesome. Don't know if Madison had anything to add, or Miss Stacy.
No, I completely agree with Dr. Miller. I feel like ever since I was young, I was always visualizing things. I was always looking at body language and people's facial expressions and dogs' expressions. So I feel like that was just a very added benefit coming into veterinary medicine when we're in class and we're getting taught that. And I'm like, okay.
Stacey said, I know when I was growing up, it was strange watching people and their behavior sometimes was very strange. It was about body language, about personality, watching them. You could always tell when they were angry. Or happy, or if they were playing or being silly or whatever they were doing. You could always act things out for sure.
Awesome. Okay, so let's move on to the next question. And it says, are there any mistakes that well-intentioned individuals might make when trying to assist deaf/HOH hard of hearing individuals that we might not realize we do?
I'd like to answer that one for starters. I think, again, assuming that we're less than, going ahead and doing something, whether rather than treating us as the professionals that we are and giving us the choice, assuming that we need them to go communicate with the client. But it's just treating us differently than someone of the same position. We have the same education, the same training, same capabilities. Again, it has to go back to what I said in my presentation. You need to ask the deaf and hard of hearing person what they want, how you can best support them, not assume that you know what that is or how that looks.
I just want to add to, just because I just had an experience actually last weekend, is getting, even as a hard of hearing person, just getting our attention. I was in a store and I was waiting in line for something and not paying attention, and the lady at the cashier was snapping at me to get my attention, just like in front of me, and I just not very agitated with myself. She probably didn't realize that I was hard of hearing, or didn't realize that I honestly just didn't hear her or see her yelling at me. So just not assuming, like you said, is the big thing. Whether you're deaf or hard of hearing, even people who can hear just a little bit sometimes don't hear you. So not assuming and just nicely getting our attention. And like you said, communicating, always being face to face when you're talking.
Most of the time watching other people too, and I have to let them know that I'm deaf. And once I tell them that, they're like, oh, okay. And they will repeat it again. I usually don't really have any problems with that.
For me, I don't have a big problem with people acting disrespectful or, doubting my ability, mostly because I followed another deaf vet in school. So most of the professors and teachers had already sort of experienced that. So I was really, really fortunate. But with professionals that had an experience working with me. Um, I'm not stupid, but I'm not the smartest person ever just because I'm deaf. So meeting meeting hearing professionals that assumed that I was some wonder kid because I was deaf and able to understand veterinary medicine was a little bit offensive. you know so for me, I'm not that special needs kid that's making a basket because everyone's letting me do it. I'm working hard. I'm there because I earned it. And treating me with respect was important. I was equal to the other hearing students. But like I said, most of the people in Michigan State were already used to deaf people. They were already used to giving support, so it wasn't that challenging for me. Others might not experience the same thing.
That's wonderful. That's great.
Alrighty, so we can hop on to the next question. And this next category is regarding veterinary clinics. So this question is specifically to Stacy, and it says, what are some ways a veterinary hospital could best accommodate deaf pet owners like you?
Um, Sometimes I have a hard time when they write. It would be nice if they write when we're talking back and forth. That would be great. Or just finding different ways, to handle deafness in general, communicate with us.
Could I say something here? I also want to make sure that people are aware that, again, I mentioned that there's those speech to text apps, but that's great for a hearing person who's trying to communicate somebody with deaf or hard of hearing. But what they have to say is just as important. There was actually a discussion on a DVM moms group recently that kind of went a little haywire because someone was complaining that their client had asked them to provide an interpreter for them. And what I think a lot of people aren't aware of is that there is video remote interpreting. And many times that can be less expensive to provide. For us that own small businesses, yes, we do have to watch our money too. We are legally obligated to provide accessibility though. So just being aware that you can have a situation where you have an iPad or a laptop and you have an interpreter there, it's just like we are using here, and they can facilitate that communication between you and your client too.
Dr. Miller, I saw you unmuted yourself.
And using text messages work too, with the phone.
And it's interesting because it's not only deaf clients that need help with communication. You found that you have older clients that can't hear as well, especially in a barking room, or with the loud noises around. Right now in a parking lot with cars driving by, you can't hear as well, even if you're hearing. So using effective strategy with writing, printing out your recommendations and then circling or highlighting in front of the owner, having an iPad that you're willing to type in front with big letters is helpful to some of our older clients that can, they're not deaf, they don't sign, but they can't hear easily. So always having that secondary way to communicate in the room or in the parking lot right now is helpful.
Yes, it is very helpful, and I really appreciate that, definitely.
Okay, thank you guys. Somebody else sent in a question and it said, would it be best to start by saying I know no ASL and then having them let me know if they can read lips, or should I have writing tools at my disposal to begin my introduction? I'm afraid I've had no exposure to the deaf community.
Normally, I don't have any problems with people asking me directly. They can ask me directly. I've not had any of those issues. I'd rather them ask directly to solve that issue right then and there instead of kind of assuming. It just makes it worse. If they ask me, then I'm able to lip read and let them know that if I can, and then we get along just great. Normally people say, hey, can you read lips? And obviously I can notice that. Deaf people are aware of that, or we can write back and forth. Either way, I personally I don't think there's no right or wrong answer for it, really. You have to do the best you can so that it's most efficient. But that's my answer to that.
I think a lot of it has to do with the fact that you're putting an effort in, you're being empathetic, that you're showing that you have a genuine interest in facilitating communication. That goes a long way to establishing trust between patient and between client and doctor or employee.
And I want to make a point that lip reading is helpful, yes, as a support. It's not 100%. And if you're trying to communicate clearly, relying only on lip reading, well, often you'll lose a lot. So with clients who look at me and they said, oh, you're deaf, you're deaf. I know my ABCs, you lip read. It's not very helpful. So don't make the assumption that if say, yeah, I lip read, it doesn't mean they understand everything. And it's also not a hearing person's opportunity to practice their ASL, okay? If you know when you're fluent in sign language, then try to communicate in sign language. But understand, not all deaf people know ASL, not all know sign language, and you might be wasting time and making them feel because you're signing without asking. So just people ask me all the time, what do you prefer? How is best to communicate with you? I'm not offended by that at all. It's fine.
That's true. That's true.
Okay. And then I know we've touched on this a little bit, but maybe if anyone had any last minute comments, what things can vet clinics and people in general do to create a more deaf friendly environment? So I know we've talked about the apps, we've talked about interpreters, and we've talked about just making that effort. Did you guys want to add anything else to this topic?
Acoustics, for those of us that do have some hearing, that still have challenging, or as Dr. Miller mentioned, have your older people that are starting to lose some hearing. Just acoustics and layout, if you're building a building, what you bring into furniture makes a difference, how it's arranged. There is so much actually being done now if anybody here is from educational institutions, there's so much being done now, research on how to make educational institutions accessible for many different abilities, not just hearing. So there's a lot out there.
And I think to add, whatever environment, if as a deaf person going into that environment, having a person that faces you, that's not chewing gum, with a heavy mustache, or a person that is speaking clearly and not trying to be on the phone or looking at a computer while they're typing, that's a big one. If you're writing your notes or on a computer as you're speaking to a deaf client, they're missing everything. So make sure that, we say eye contact, we say it over and over, but that means do nothing else except for speaking to that client. That's it. That's it. So that's very helpful. When I go into a business, or I'm at the airport pre-COVID days, for me, people that look at me, oh, you're deaf. Okay. Do you understand what I'm saying right now? Do I need to change anything? Go on. That was the most helpful for me.
Alrighty. Okay, so our next topic on my list of submitted questions is regarding vet school. So how do the deaf, and I'm sure, our two veterinarians here could also pitch in from your experiences. How do deaf, hard of hearing students prepare for exams or deal with working among other hearing peers, especially with everyone wearing non-transparent masks nowadays?
This is Tyler. I prepare for an exam just like any other student does. I'm just like everyone else. There's no difference for me, honestly. And the way that I communicate with my peers, I use interpreters all the time. I have two interpreters, two designated full-time interpreters with me all the time. And we communicate with the students just fine. For masks, the University of Florida has been really great. They have promoted the students and staff and educated them so that we could use clear masks. They've ordered quite a large amount of them, of each of those, have given them out to the students and the staff, and they do use them. So that is quite a benefit for me. And that way I can see the tone, if they're happy or they're unhappy and they're sad. I can identify that. I can't do that through sound, but I can see that through their mouth. So that is quite a benefit. So I've been able to communicate with everybody.
Yeah, I mean, the same thing. I study just as much. I do struggle a lot in watching lectures. So I do go back and watch lectures that are closed captioned, as some of the live caption isn't always perfect. But like you said, it's all about just finding ways. The clear mask have been super helpful. But other than that, I think it's been the same old, same old. Like you said, we're not any different. We don't do any special tips other than find ways that we can better ourselves.
That's wonderful. That's really great. I'm happy that you're able to communicate with the other students. That's great. I'm not the only one that's deaf, and so I don't always know that's the situations that are going on because I am, but that's wonderful that you guys can communicate. Everyone seems to really, when we're doing anything, it's really great. It's nice when we can all be equal.
For me, in vet school was a long time ago. 10 years and 3 children ago, so a lifetime. For me, it was helpful. My teachers that were willing to give me materials ahead of class was helpful. Knowing which chapters to read before so that I could focus more on what they were saying instead of what the slides popped up was helpful for me. Having surgeons willing to, they used to bring tissue pens that you're used to mark on the body of the animals that are sterile. But they used to bring them into surgery and they would write on the drapes. Trying to get, having my interpreter interpret was great. I always had 2 interpreter teams with me. It was one at a time and then they would take a break and they were with me all the time. And for lectures, I had captionists. So you understand, I never skipped a class because if I did that, my captionist would know I was missing. My interpreter would show up without a student to interpret for. So I could never fall asleep. I could never skip class. And I always had to sit in the front. So you're forced to look like a good student.
Tyler says, yes, I want to add something to that as well. Both of my interpreters have access to Canvas, and they study and prepare prior to the lectures. So they're aware of the topics and the things that we're going to discuss, so that when we start, they're ready to go. That's helped immensely. UF has given them access to Canvas, so it's been very helpful.
All right. The next question is, and I know that we might be touching on topics over and over again. I just want to make sure we do cover everything if we have time. What do you wish your student peers knew or did differently?
Tyler says, I wish my peers didn't have any assumptions, first of all. I wish that was the case. I wish that would not happen. There's nothing that I can do about that, but they have to get along with me. And then once they get to know me, they realize, I understand it's not their fault that there's always an assumption. They don't know who I am. They always assume I can't do anything. So I'm like, yes, I can do it, the same thing that they can. So I just wish my peers were not, they didn't assume anything.
I think I go along with you is when there's no masks on and I can lip read and there's not too many people in a setting, I'm basically seen as a hearing person. I adapt very well. I can speak well. So everyone makes assumptions that I still don't need to see your face, that I still don't need to be able to read your lips. And I think even my own parents to this day go into another room and start speaking. And I just sit there and roll my eyes sometimes, but it's just sometimes getting forgotten when you don't have that physical attribute or that you just kind of get missed, and then people forget. So it's not even just people in our school, but in society and things like that, like you said, just not making assumptions that just because I can lip read really well, I use my hearing aids, doesn't mean that I can understand you. My brain is still working 10 times as hard to be able to understand the words that are coming out. So that's just my little take.
Again, student years were long ago for me, but I remember I'm still best friends with my anatomy lab partners, still best friends. Our children consider each other cousins. We visit each other. I'm still good, close friends with the people that took the time to know who I was, with and without my interpreters. My biggest advice for vet students now working with a deaf or hard of hearing person is don't turn down the lights. Don't expect us to understand anything with lights low. Don't think you can communicate during a meal easily. It's not possible. You're at a big party. You can't it's pre-COVID days, remember, but you can't understand anything while people are eating. You can't. Include us. Sometimes they get used to dealing with us with our interpreters, and then if they see us outside of that setting without our captionists or interpreters, they freeze. Like, I don't know how to deal or communicate with you. No, come on, it's still me. We'll figure it out. So just remember, we're people that want a social life and people that want to feel included. Keep the lights on, and we'll be good.
Okay. A few more vet school questions. What accommodations do you have at school, and how can they be improved? And how did you find the right ASL interpreter for vet med?
Who wants to answer that? Tyler? Well, I have 2 designated interpreters. I also have captioning and recordings for almost all of the classes are captioned and videotaped. I had that as an accommodation. I'm satisfied with that. So I love those. I have really great qualified interpreters. They seem to be able to handle the vet classes and everything is great. Captioning is great. So I'm satisfied with that. How did I find my interpreters? Well, that was hard. Here in Gainesville, it's a small town. There's not a whole lot of deaf consumers here and a lot of deaf people. So I had to search outside of Gainesville, Jacksonville, Tampa, Orlando. I contacted quite a few deaf people here. I chatted with them, wanted to know who they thought were the skilled interpreters in the area. Then I contacted them through Facebook, I really did interviews myself. I did. I sat down with them and wanted to see what their skills were. I wanted to see if we were going to be a good match, if they were going to be able to voice for me well, if that was going to work out. Then I communicated with UF and let the office know the specific interpreters that I wanted to use for my vet education. So far it has been great.
I actually have a question for Tyler. I think it's great that you were able to pick who you wanted. At the same time, I also wondered, did you get any support from the school in helping to find these people, or did they say you have to figure it all out on your own? Okay.
No, UF had some suggestions. They had an interpreter's list. I just kind of felt that maybe those would not be the greatest for me. So I'm fairly assertive. I was advocating for myself. I wanted the best qualified interpreters for the vet school. I knew it was not going to be easy. The curriculum's hard. I really needed two very qualified, top advanced interpreters to be able to go through this with me. So I did find two, pulled them in, and here we are. I am a very assertive advocate for myself, have been. So I really want to make sure that I get the top qualified interpreters so that matches my needs.
Right. If it's I have something to say that's kind of tied to this question, and Tyler, what he just said. I found out, but if we have anybody on here who's a parent or who have a student of a child who's thinking they want to go into veterinary medicine, or who is pre-vet school, I found out later from one of my professors that was on the admissions committee. They told me that the reason that I was admitted, I mean, I met the criteria, but obviously they were concerned about my hearing loss. One of the reasons that they said I was admitted was because I didn't sit back and expect them to do everything for me. I mentioned that I had already started researching solutions to problems. I didn't have all the answers, but it was obvious I had ideas and I had support, and I was going to try things, and I had already contacted the disability office. They got involved. In fact, one of my professors themselves, he redesigned and connected two of my FM systems because we had a dual teaching class. And I couldn't hear one and then not the other. So the school got involved, but she told me the reason that they admitted me was because I was obviously not going to be passive. I was part of it. And that's what Tyler kind of just spoke to. And I think that self-advocacy is so important. It also has to do with what I said before about people don't know what's going to work for us. They may assume that we can speech read or whatnot, but that may not be the case. We may need something different. So you've got to have an assertive personality.
One of the things I want to add is that when I signed my acceptance letter to UF, the very first thing I did, before I even celebrated, the first thing I did was I contacted the DRC, the disabilities office, and I registered with that office immediately before I ever signed my letter, because I knew this was going to be a long process. I knew that I wanted to get the right accommodations, and I knew what I needed.
Also, in the same, a little bit different perspective, sometimes individuals' experience with deaf people is not as pleasant. Sometimes they'll meet an individual, whether they're deaf or from a different culture, or a woman or a man or gay or straight, or, they feel that themselves is, they have to advocate for themselves. So sometimes they might have already met a deaf person that was you must do this for me and me. I'm the most important. And if that was their experience in the past, they might meet you and go, I don't want to deal with this. So having a plan that's reasonable. I didn't expect them to have 14 good interpreters for me. I didn't expect them to have perfect lighting or perfect professors. I advocated for myself, but I also had to be flexible and work with them. It was very frustrating at times, but understand the perspective that sometimes the last deaf person they met was just a brat. I mean, maybe. So understand that you have to show yourself willing to behave professionally, and understand that life is different for each person, and be willing to be flexible. For me, that's very important. When I got accepted to vet school, I celebrated. I did. I was very excited. But when I entered, I had one good interpreter. And my mom's an interpreter. My best friend's an interpreter. I know what good interpreters are. And I had, after that, a slew of terrible interpreters. Terrible. Just nice ladies and men that could not sign to that skill level and were not willing to learn. So for some of us, we have to sit through and fire them, sit through and fire them, sit through and fire them. I wasn't smart enough to require interviewing. I just sat there and said, you're not going to work. Next. So the process is a little bit different, but to be positive and be fair and a little bit flexible for all of us is important.
Yeah, and I'll kind of go on that as well, because I wasn't like Tyler. I did not come into vet school with the most high advocacy. And honestly, with him and some other people, I gained a lot. I didn't stand up for myself a lot in undergrad and when I was younger. And finally, once I got my diagnosis and finally understood what the problem was, I then started standing up for myself. But I hit a lot of barriers, especially in undergrad. I didn't know what was available to me, what I deserved. And that was a struggle. But then I finally got pushed for me to get hearing aids, and that was kind of my big step of advocacy. But I still didn't have anything but preferential seating until I got to graduate school, where I got closed captioning. And it was very helpful in the sense that I would be able to get the recorded videos, but I was still always falling behind because I wasn't really understanding these 2-hour, 8-hour long days of intense information. And so I got live captioning, which is what I have now, but I don't have the same experiences. Right now, I keep getting denied for CART captioning, which is a real-time captioner versus Zoom captioning, which is an automated system. So I'm right now living through automated systems, and it's not very correct. So I am still advocating for myself. I'm still fighting for that CART captioning, but it's something that I didn't realize was a real thing until you really get into it. And it's hard. It's definitely, I get teared down every time I get a denying. And I keep fighting back and I keep getting denied, but it's something that I've realized that a lot of people in the hard of hearing and deaf community have dealt with. And it's something that, while it should be better in 2021, it's still something that we're still advocating to this day. And I will continue still advocating for myself. And I'm so thankful for the community I have, for the people and the connections that I've gotten, not only today, but in the past, and we'll keep going. But that's right now my accommodations: preferential seating, live captioning, and I use assistive technology. So when I'm in person, I have a system that goes directly to kind of like an FN system, but it's even more high tech. It's just a phone acting. So it's this little thing I can attach to the professor, and it goes directly to my hearing aids. So it's just a little added benefit, but of course with masks right now, it's not easily understood as well because muffled noises. So just understanding and that we're still working on advocacy, and it's still a problem even in 2021. So for those that are hearing, it's not perfect.
When I was told that I couldn't have a CART person because I was already using interpreters for my school system, there was one administrator that didn't get it, and the rest of them didn't. So I just kept having meetings, And I remember the final straw was saying, "You're embarrassing yourselves having a student note take for me in a professional setting." But it took several meetings, and you have to keep a professional tone and you can't act like an entitled brat. But I would encourage you to reach out to me, Dr. R, and maybe give you some resources and some assistance on the language that you need to use, because if I could do it 10 years ago in the Midwest, you can too. Okay.
I just want to
That-
echo.
For that situation that Madison talked about, that's a lot of what Ample has gotten involved in. If anyone struggles with similar situations to Madison, I suggest you contact them for some guidance. I can probably point you in directions. I'm no longer on the board, but that's what we're there for, you know.
Awesome, thank you. And it's a great resource for others who are struggling as well.
I just wanted to say, as a hearing person, and for all the hearing people here, all the students, I highly encourage you to, when you're rewatching your lectures, take a look at like the Otter AI, right? That's what it's called, Otter AI on the side, and take a look at this cart captioning, and you can definitely see the difference. I mean, if you just had Otter AI, if I just had to read that, I would not be passing my exams. So I think it's also just a big part of us, you know, opening our eyes, you know, like and seeing what's actually going on in our school, and just, yeah, we're always here for you guys for sure, and we're always fighting. We're still, if they can do it in the Midwest, we can do it too. I like that. But I just have one more question here regarding vet school, and it's regarding the professors. This person just asked, you know, what about the teachers? Are they helpful or more on your own type of approach?
Mine's happy. I'll go first. I love my teachers. Again, they had already been started by Dr. Dodge, who is deaf and doesn't use a voice. So, and she's just so brilliant and so nice. And she really helped me train all these teachers and doctors. But you still have to prove yourself. But after you prove yourself willing to be flexible and calm and willing to put the extra work in, my professors were very supportive. I think I had one on an externship. It was a vet that I went and I rode in his truck with him to do pregnancy checks on cats. Right back then, I planned on being a large animal vet. Anyway, he looked at me and he said, "People are going to think you're a retard because you're deaf. And you took the spot of a hearing person who was willing and couldn't get into school." And I looked at him and I said, "Well, that's one perspective, but no one's been dumb enough to say it out loud." And it's funny, I still once in a while I'm in touch with that old vet, and it just shocked him for someone to just look at him and say, "What gives? No, you can't say that." So being very direct with people that maybe aren't as worldly on how to be respectful to differences helps too. I'm a very direct person. That's not hard for me. And the day I bought a clinic, I wrote him a note to let him know, and it felt good.
Yeah, I can't speak for Tyler, but I think we started at a very weird time, since we started with all of our classes being on Zoom. So I think we struggled the same with all of our peers and really getting to know our professors. It was a struggle, I think, for our whole class to get to know one another, to get to want to know our professors in more of an intimate setting, because we barely had time for a break between each classes, let alone getting to know them. So I think maybe once we're more in person, we'll get a better interaction with our professors. But right now it's touch and go. But I think we have fun in anatomy.
I have something I want to say too. After I graduated a few years later, I went back to State College of Veterinary Medicine because one of my dogs needed a specialized surgical procedure. And while I was waiting, I saw many of my professors, and one of them I started talking to. And I asked him, this was maybe 5 years after I graduated, I said, what was it like having me as a student? And not just me, but as a deaf student. And he looked at me and he said it was hard. And I do want to say, while we are afforded equal access to education and employment, I do think that we need to apply the same empathy to those that are trying to make that happen, even if they're going out of their way, obviously, and they're being good, just saying that thank you, saying I really appreciate you. That's going to really make them want to keep doing what they're doing. And I realized I had never really done that. I mean, maybe with a couple that I had really bonded with and became my mentors, but I really should have been a little more eyes open to the difficulty that it was for the administrative staff and the education, what they were doing for me. I was so focused on what I needed. It's just something to keep in mind, too.
Alrighty. So we're gonna hop on to the next topic because we're running out of time here. So, any suggestions for improving deaf etiquette? Oh, this person is asking about reliable resources. Are there any specific books, courses, etc., that you would recommend for a person interested in learning ASL?
This is Taylor. I think Gallaudet University has some good resources related to learning ASL, and they've got free online classes already established there. I believe that they have some deaf culture information as well that you can read. I also think the best way to learn from deaf culture and learn ASL is to really be with deaf people. That is really the best way. You need to socialize, you need to get out there. It's going to be the best way for you to acquire that language and knowledge.
And I don't want to just stop encouraging someone to learn ASL, but it's similar to a hearing person saying, well, I want to speak to clients in Spanish, so I'll take Spanish lessons. Maybe if you live in the South, that makes sense because you hear it all the time. But if you live in the North, you're trying to learn Spanish without an immersion program, your ability to really communicate is going to be limited. Okay. So if you want to learn ASL or learn some signs, the effort is appreciated, yes, but clients that want to practice their signing skills with me waste time. A few signs here and there, fine, but trying to communicate completely in sign language without being fluent in it is not that helpful. It's better to use other resources to communicate better in a clinic than try to do from best intentions. I understand, but clients that try to sign with me, it's not helpful. And I agree. NTID, Gallaudet, every deaf movie you can think of, watch it. Mr. Holland's Opus is a great way of explaining how it feels to be isolated in our world. And really just being willing to understand that even me and the other people on this panel are different. Our experiences are different. Our upbringings are so different. And deafness is for me, a big part of me inside, but to the rest of the world is such a small part of me. Don't make assumptions. Just, it doesn't matter how you communicate, just be willing to communicate clearly, however you can.
Alrighty. Well, it is just about 7:30, so I think that is to end. If you guys had, I'll open it right now. If you guys had anything else to add before we close off, I know that there are a few questions in the chat, but I don't want to keep you guys here forever either. And I encourage anyone who still had questions to reach out to our panelists. But I'm going to open it to the panelists if you guys had any last minute thoughts before we close for today.
It was nice to meet you guys. I see a question that says, how do we study for tests if we're the only deaf student in the class? I have classmates. I study with them. I read a lot. I at home I am reading like a fiend. So anatomy and physiology, I studied with other students. I have classmates. We had study groups. We had a good group of students.
Same, I read ahead, read during, read after, read. So for me, that is a good skill to have now, because if I'm doing a surgery I haven't done in a while, I can read really quick and remember it and move on with my day. But also forming strong relationships with my classmates. I was able to do that. Wasn't in the age of Zoom. So for me, close relationships with classmates who were willing to communicate without interpreter. And there were a few of them, and as they got more used to me more, but that was helpful. And it's interesting because I remember one man that I studied with said that, you know, his ability to learn big concepts and understand them, his weakness was always the details. So when he studied with me, he was forced to focus more on the details, and he forced me to look at the big picture more. And when you're trying to learn 6 tests in 1 week, that's helpful. So we study like others. I studied like other students studied, but I do think that I arrived to class with a little bit more willingness to work ahead of time, so that I didn't feel so lost. And so I have to do a lot of reading.
All right, well, it's 7:32, so I'm gonna let you guys go. I really appreciate everyone here appreciates you guys taking the time from your busy schedules. I know it's crazy, especially in the world of Zoom University and curbside veterinary medicine. But yeah, thank you so much for your time and for being here and sharing your experiences. And thank you to the interpreters being here after hours. um, and yeah, I hope everyone has a good night. Please, this was recorded. I will post the link as soon as I have it on all the socials, on all on email listservs, on all the things that I posted on. And yeah, please follow us on Instagram at uf.dvms for diversity for any future events. And I highly encourage you guys to follow Dr. Rassiter. It's at Pets and Stitches, and we've tagged them in a few things already. And yeah, thank you all for your time and for being here, and I appreciate it. And we're always working to make things better and keep making things better in vet med and for our clients and for our coworkers. So that's it. You guys for being here, and I hope everyone has a great night. Bye, everyone.